Welcome to Continuum, powered by Senior Placement Solutions, the show where we pull back the curtain on aging. I'm Ben Kribs, and today I'm joined by Dr. Mark Gomez, a highly established concierge medicine doctor with over 22 years of experience, highly rated, acclaimed by his patients, and a doctor who leads with prevention and builds everything on relationship. Dr. G, how are you today?
I'm doing good. Thanks, Ben. It's good seeing you, and thank you for inviting me on your show today. I can't wait to talk more about what I do and really some of the themes that are important to us as we take care of each other.
Thank you for being the first guest.
You bet.
So, before we get into medicine, I think when we had the initial call with you to kind of prep for this, we heard you say you were inspired initially by Neil deGrasse Tyson, which is why you're sitting here today. And for the audience, that is a renowned scientist, and the way he talks about science, and I guess what of his work grabbed you to, inspired you?
And so thank you for that question. Years ago, I actually got into health podcasting myself. And so I was blessed that my wife and I were able to start two podcasts in particular. The story with Neil deGrasse Tyson and what happened there was that I was listening to his podcast called Star Talk Radio, and he would always have some of the best scientists across various disciplines within science talk about particular topics. And so one day as I sat there, I go, wait a minute, if Neil can get some of the best minds together to talk content and talk science, why can't I do the same thing in a health sphere? And the thing that really got me going was, actually I had a patient who mentioned that she didn't want to have a mammogram. So we were talking, this is years ago, 2018, and she mentions to me, she goes, I mentioned to her and I go, it's time for a screening mammogram. You're in your 40s now. We should be talking about this. And she kind of said, Doc, I won't do a mammogram. Mammograms cause breast cancer. And at that moment I said, okay, we got to now really talk about refocusing the conversation on education and making sure the record's set straight. So between Neil and getting people together and some of my patient interactions, where again, I want my patients to feel empowered. I mean, I want them to know, but I want them to make sure they have information that's rooted in evidence. And so I said, you know what? I talked to my wife and we decided we're gonna go ahead and start something. So we started a podcast in 2018. It was called To Your Health with Dr. G. Yeah. And we recorded at a small studio in the Chicago suburbs, and the rest is history. We were fortunate shortly after the pandemic to have our second version of a podcast called Health 360 with Dr. G, and we were able to reach more and more people across the country. So really my message was about how can we have the right people at the right time talk about health and make health less intimidating and empower people to be the best versions of themselves.
Well, and I think he's a brilliant man in him being able to filter that information to the average audience, right? Of normal intellect, right? How he can take that information and digest it and regurgitate it, I think that's what you do with your practice.
That's every day.
Yes.
Every day we have to just kind of, I think the thing what physicians do, and I love what I get to do, is I get to really be somebody's coach, somebody's advisor, and to make sure that they're positioned for success as well too. And so I take that job seriously, but I'm also incredibly humbled that I can do that as well to make sure, again, that people make the right decisions. And I say this in my practice, I go, 3 things that I think about for you. Number 1, longevity. Are we set up for long, healthy living? Number 2, vitality. Can we feel good while we're living long and making sure that we're able to interact with the people that matter most? And then number 3, quality of life. And with that, you get kind of sense of purpose. And just the journey that we're on, can we have people just live healthy lives and making sure that they have the resources for success?
The word journey, that came up quite a bit when we talked on Sunday. And what does that look like for What did that look like for you when you started as in residency, and even probably prior to that to then now?
So my journey began actually, I knew I wanted to be a doctor when I was 9 years old. So my journey started a long time ago. And it's interesting, in my eighth grade yearbook when I was 13, I wrote future plans and it said become a physician. And I unearthed that picture maybe about 2 or 3 years ago. Unearthed that picture. And so actually I still keep that picture of a 13-year-old me with braces on that says future plans, become a physician. So I knew what I wanted to do at an early age. And actually I still show that picture to young people, or even I show it to some of my patients. I'll say, hey, you want to see a quick retro picture before we talk back about your health again? There's this kid here with braces. That's me. It's in black and white, but here I am now today in the present, and we're going to talk about our journey. And so my journey's been very clear from the start. Of course, at any journey, you have to have people along the way that inspire you, that motivate you. I can't do anything without family and faith. My wife has been my biggest supporter. Of course, my parents and my brother and my sister, really the community that helps you reach your goals.
Takes a village.
Takes a village.
Yeah, absolutely.
Takes a village. Well, when you think about it, you want to surround yourself with the people, even in the health sphere. I want to make sure my patients have the right resources, so it's surrounding themselves with the people that will help them reach their goals too. I'm just one piece of it. The good thing is me as a primary care physician is that I can really help quarterback the story and the journey.
So you said you give them what you tell them is, this is what I want to understand in your story with longevity. With longevity, how does that play with prevention?
And I like to use a phrase, an ounce of prevention is worth a pound of cure. And that is really kind of the cornerstone of our messaging. The great thing about what I get to do so I'm a concierge medicine doctor. I spent the first 13 years of my practice doing traditional primary care, and then the last 6 years doing concierge medicine. And what I really like about that is by me intentionally seeing fewer patients, I'm allowed to have more of a deeper and meaningful and long-term relationship with patients. And I think that's the thing that drives, you can create impact. You don't have to create big impact, but sometimes little things matter too. So if I can have more of that meaningful conversation deeper, not to worry about the time, then I think we can really get to those goals that we want to have. And knowing your patients is critically important in medicine. Otherwise, it's cookie cutter approaches and we're not making meaningful impact. And then lastly, I'd say you're not getting the transfer, the exchange, the value exchange, the knowledge that needs to happen that I truly believe in every visit I have with a patient.
Specifically with the aging population, what are you seeing what are they doing for prevention, or maybe not doing, I guess, lack thereof?
So I think about a few things that are foundational for seniors, and I have the blessings to take care of many seniors in my practice. It comes down to a few things. Number one, it comes down to getting regular exams. It's critically important for seniors to have a regular annual physical exam. And I really say, you gotta touch somebody. You need a hands-on examination as a wellness check on an annual basis. That's the first thing that I tell my patients to do in seniors. Number two, physical activity. We have to continue to engage in physical activity to the best of our ability across the lifespan. It just is there. Who doesn't want more strength? But exercise is medicine, and it's foundational to success. Number three, nutrition. We have to continue to focus on healthy eating, high quality mineral dense foods that can nourish the body as we go through our health journeys. And we do know that things like diabetes and heart disease and cancer, arguably many of this is preventable through healthy choices. It doesn't account for everything, but arguably, believe it was the CDC years ago that said 80% of heart disease can be prevented through lifestyle. 80% of type 2 diabetics can be prevented through lifestyle. Cancer can be prevented by at least 40% of cancer if we have the healthy foundations. So even as people get older, we still need to stick to those foundations. Medication management. As we get older, yes, we do have a higher likelihood of getting multiple conditions. So it's important to have medication management to make sure there's no concerns or confusion about medication, and also looking at polypharmacy, which is when medicines together may have a negative effect. And so you want to make sure that we're ruling that out. And lastly, for people as they get older, for prevention, it's really about safety. Home safety assessments. You believe it, Ben. I get calls where people fall at home, things that could have been prevented. One of the things we do in our practice, we do a comprehensive balance and gait analysis and an assessment that may give us a prediction over the next year if a senior is going to fall or not. And we kind of rank our seniors into kind of low risk for falling, moderate risk for falling in the next 12 months, or higher risk for falling. So we have ways to measure this objectively in the office setting and then apply that for those that are at higher risk. But safety is incredibly important for seniors as they get older as part of a preventive plan.
And self-awareness.
Self-awareness, I love that self-awareness is maybe arguably our most valuable necessary asset that we can use. We have to continue to look internally so we can give more external love as well to the people that matter too. But we have to give ourselves the grace to look internally and listen. It's one thing to look, you gotta listen too. Yeah.
I think I saw something the other day about the real currency in life is attention. And I think that really genuinely struck a chord. I'm raising a family, a young family at that. And so I think the idea of attention is the real currency these days. Not anything physical, that's the attention. And so going back to listening to our clients and our families is so important. That touch the high quality and maybe lower scale, but higher impact, like you said.
I think that's super important. My goal if I have an interaction with one of my patients is that by the end of that visit, there's no ambiguity. And when there's ambiguity, problems happen. We need clarity. There's that saying, if there's ambiguity, when there's ambiguity, seek clarity. And so it's my goal to make sure that we are having that exchange, and that's really what helps keep people out of the ER, minimizing trips to the hospital, potentially accident prevention, making sure we're compliant with medications and other kind of support measures. But we have to have clarity. And the conversation has to be there too. So we can't do it in 15 minutes. We need to really take our time. And that's paying attention.
Yeah. Well, I think that's why the concierge approach works. It's built for that.
I'm very fortunate to be where I'm at, and I don't take any of that for granted. I'm very fortunate to be able to practice concierge medicine. But for me, when I made my switch, my transition 6 years ago, I actually did it because I was trying to find the fastest path. Talk about my journey. I was trying to find the fastest way home to the people that matter most. We know medicine has changed, and the only constant in life is change. And so medicine was changing rapidly. I was still I was grateful for all my patients. I was burnt out. I hit a wall thinking about ready to, what am I gonna do? Can I do this another 20 years or not? And so also I wanted to make sure I wasn't missing the people that matter most, my wife and my 2 children who were younger at the time. And so when the opportunity came up to consider concierge medicine through our health system, I jumped right at it, absolutely. And I'm very grateful that it worked out to make a transition, and nothing that I'll look back, I won't ever go back, but it's something that I'm very grateful for. And now we can make impact in this way. If your physician is burnt out, there's going to be no way to exchange information if your physician's really struggling too. So caregivers, physicians, family members, burnout is real. And even when you take care of seniors, think about family members, and you and I have had tons of conversations. It can be tough.
Yeah, and those conversations should start well in advance of the crises, typically.
So it's interesting when I think about some of my 40-year-olds or 50-year-olds and saying like, hey, in a couple of decades, you're going to be that population. You're going to be that cohort. What can we do now to mitigate any future risks, or how can we just better plan? Sometimes it's hard to think about that when you're in your 40s or 50s. You're not really thinking, or even your 30s, shucks, you're not even thinking about decades down the road where you have higher risk for heart disease, higher risk for cancer. Once somebody turns age 50, they have a 13 times higher lifetime cancer risk than if they were younger than age 50. And so we have to have these conversations, but you have to have them early, because if you have them too late, then you miss the opportunity. Yeah. One of the cool things that we get to do in our practice is we look at hidden risks. It's something called polygenic risk scores. Now, when you see your physician, he or she, you might get your regular examination. What I get to do in my practice is we get to look at things that we may not be testing for. What if somebody has a higher lifetime risk for abdominal aortic aneurysm or atrial fibrillation, or a higher risk for certain cancers based on genetics alone, not looking at things like environment that could also modulate risk. But you can really look at what's out there that I might need to be aware of, and then can you mitigate on that? And so I have a story where I had a patient of mine who's in her 50s, and we did a genetic analysis, polygenic risk scores, to see what is the likelihood of getting a condition. And by the way, how it works is very straightforward. You and I right here, right now, we are 99.9% identical genetically wise. There's only small changes that make differences. We call those variants. And so on average, the average human has about 3 or 4 million variants in their DNA and their genetic code. That actually allows you to have things like your eye color or your taste buds or your height. But those same variants, these changes, can lead to hidden risks, higher risk for things like heart disease or diabetes or cancers or kidney disease, or even looking at dementia, Alzheimer's, or other kinds of blood clots. So we can look at a lot of different things and say, we're not putting like a voodoo curse on somebody, but we're just saying you have a higher probability based on genetics alone. Or maybe somebody has a lower probability than the average American might have, and that might be a little more protective. So we're actually in a really good thing. Even with my seniors, that even my patients that may be in their 70s or 80s, some of them are still interested in looking at this because it may help for legacy when you look at the next generation. So we always like to do testing on people if they're interested.
And that's part of the practice?
Yeah, part of something we do. Yeah, we do a lot of fun things in Concierge. And these are hot topics. Polygenic risk scores, which were bigger. It's still big in Europe, but it's slowly growing in this country, but was big in Europe 5 years ago. Multi-cancer early detection, which is critically important. We only screen for of all cancers in this country. Screening only accounts for about 14% of cancer diagnoses, which means that by the time we diagnose people in a conventional manner, we diagnose them on methods that are not screen available. And so it's important to talk next generation. Pharmacogenomics, think about seniors and medicines. Are we given the right medicines based on how their body may metabolize medicines? So there's a lot to go out there. And then there's stuff like 3D imaging that you can do. There's a lot of stuff for heart disease and other awareness as well.
With urinary tract infections with seniors, it's interesting that in my role as a licensed social worker, I'm sometimes having conversations with families that are looking to possibly move mom and dad into a community, and I'm hearing that they may not be receiving the antibiotics as well. And I think sometimes that is because the body has adapted to those certain, and it's, so I usually have them go back to their doctor and see if we can get that tested. But to your point, polygenic, I think that it's nail on the head with finding what medicines are going to work.
Yeah, pharmacogenomics, and it's really interesting. And again, it's still an evolving science, but there's some really good movers and shakers out there where we can try to predict. And I think when it comes to modeling and health, it's really, yes, we have to be data-driven and evidence-based driven, but it's okay at the same time to innovate in the ways that we can best care for our patients. And if we go back to that saying of an ounce of prevention is worth a pound of cure, if we know what we might be up against, I think we can truly make some impact. Yes. Yeah, absolutely.
So it was funny because when we had the prep conversation, we talked, one of the words that came up again was fragmented care, which we already touched on, but then the name of the show is Continuum. And when my colleagues and I were coming up with the name, it was on the board for a while and we ended up coming back to it. And so I love how your word and then the name of the show, how much synergy they played together because of the fragmented care, like you said, often looks like someone who we view as a advisor in the health space is giving folks a list, and very impersonable, and I think that's with us as advisors and you as a concierge medicine, like how we are able to spend that time with families and being able to genuinely check off all of the concerns that they came in for, right? Yeah.
When I think about fragmentation and fragmented care, it's interesting. This was on my mind lately because a colleague of mine who's a spine surgeon talked about it in that niche of post-surgical care where there may be some gaps. You might give a patient a tool of some sort, and what happens on a Saturday when the machine may break down and there's no customer service till Monday on a particular device. And so that's fragmented because you have a person now who's hanging out for several days before something might be able to be done. But really, when you look at fragmentation and fragmented care, a lot of it comes from a lack of coordination. And there are some common characteristics that I see in fragmentation in the healthcare setting for seniors. There are some common things in there, and then those common characteristics can lead to some significant consequences. And so when I think about certain things that are out there, number one, that we see with seniors, multiple specialists. Again, as you get older, you're going to likely have more medical conditions, which leads to more medications and more treatments. And sometimes that care coordination, you might see one specialist, and then you go to the other specialist, and the other specialist has no idea what the first specialist was doing with treatment. But that is a missed opportunity. So having multiple specialists may have, that's saying there may be too many cooks in the kitchen. It may manifest like that, and then that can lead to a problem. Number two, communication gaps, which leads to that as well too. So if we have information coming from one person, and then information from another, and there's no medium to connect those two, you have gaps. And when there's gaps, there's exposure. And that can lead to more challenges and more consequences. Medication, we talked about medications. Once you get older, you're likely going to be on more prescription medications. We call that polypharmacy. And we have to make sure that the medicines all agree with each other. We're lucky now that we live in a society where our electronic medical record can do a quick check medication A versus all the other medicines. Doesn't matter if it's one medicine or 13 medicines, and do they all play well in the sandbox? Can I go or not? So it's important to know that medication mismanagement can happen, and especially if you think about going from a hospital setting back to the home setting, or a hospital setting to a rehab facility, then back to the medical office setting. If medicines haven't been reconciled, you think somebody's taking one thing, it's another, that could be a problem. And then lastly, when you have all those kind of barriers, you create confusion amongst your patients. And not only just the patient, confusion amongst the caregivers that are taking for them. So then what's the consequence of fragmentation? Well, it's ultimately safety risks, and then think about the family itself and the patient, emotional stress. So hence what I love in Concierge is that when we spend more time and we're more intentional, we can really make sure that we're talking about really making care a continuum, as you said. And I like that. I did it on purpose.
So, I guess that kind of bridges the misnomer of, is concierge for everyone? Is this something that your average family can afford? I think that's you hear that word, and I think a lot of folks are like, oh my gosh, I'm not in that position. And I think a lot of it maybe go back to values and what you value as well. I think you shared a story, but do you have any experience on what, demographic or just what you've seen with some of your families that are most receptive to you being a part of their team? If you're listening to this because you are caring for a loved one and you realize they may need more care than you can provide them, you don't have to figure this out alone. Senior Placement Solutions helps families across the Metro Chicago find the right community at no cost to you or your family. That is what we do every single day. You can reach us at 630-604-8928 or www.spsllc4u.com.
There is an evolution of where concierge medicine has come. When it started out, yes, it was considered the medicine for the ultra wealthy, seemingly, immediate access to your doc, 24/7, 365, care, just that kind of really high touch, white glove kind of service. But the model has evolved over the last 10 years or so, and even over the last 5 years since we've been post-pandemic. And really what you're seeing, yeah, exactly, right throughout that. I transitioned right into concierge right during the middle of a pandemic, which was crazy, and I can't believe how I did that at that time. But we are seeing this consciousness, this awakening amongst people that say, I value my health in this way, or I can't afford to not have something like this because everybody's dependent on me. So we're seeing a shift, and the shift is driven by patient demand. It's not me saying, oh, I'm Dr. G, having a concierge practice. We're getting calls all the time from people that are looking for another way to value their care, to receive their care. And what you're seeing also is you're seeing healthcare systems jump on this as well too. It's not just private practice concierge. Health systems are now investing in this as another care delivery model because it just makes sense to them to do so. But differentiated care models are important. And so we've seen a rise in concierge medicine in this country, and it's going to continue to grow for the foreseeable future. It does make you think, though, what happens if you can't do it? And that's a big thing, because we do believe I personally believe in equity. We have to have more opportunities to get everybody to the playing field at the same time. There was this one cartoon where it's 3 kids watching a baseball game, and they're they're behind a fence. Now one kid is below the fence, so he can't see any of the game. The other kid is on a stool, but his head's able to see the game, and then the third kid is just tall enough that he can see it. So you have inequity there. That kind of an analogy. How do you remove the fence for everybody? And this just tells us how the system has to improve. How can we create opportunity and access? And a lot of people don't know about me. I used to, I shouldn't say my former life, but I've done a ton of stuff in the community as a way to give back, to make sure that we are having those conversations, getting everybody to the table. I actually served in DuPage County for a number of years. I was the health coordinator, or the health chairman for the DuPage County NAACP. And so we talked about having equity and having those conversations from a policy standpoint with our regional, local, and government-based leaders. Yeah.
Jeez.
Yeah, but this is important to have these kind of conversations. And I think about people that are out there caring for others. How do we make sure they have an opportunity as well? It's about education. And going to this thing about community, how do we make impact? And that is incredibly, incredibly important. There are certain ways out there. And when I think about how do we do it, it's 3 things that I think about. Number 1, how do we listen and convene? And knowing that we must listen and convene, not how do we. We must listen and convene, and knowing that in order to understand the community, we have to listen to the community. And we have to prioritize the strengths and opportunities for the community. After we listen and convene, then we can educate and connect, and how we promote improvement in health through prevention, and how do we deliver that care. Then ultimately, if we're doing all this stuff, we can then continue to partner and invest in those communities that need us most. And that allows us to create long-term health success.
One of our missions when we started Senior Placement Solutions was, to your point, what the community will often tell you, where's the missing gaps, And I think every entrepreneur takes it, that's what we seek, right? Where's the gaps? And I think one of the value adds that we provide is we serve anyone from any resources standpoint. And so that's folks with a lot of abundance and some with not so much. And both are so equally fulfilling to serve the families in that way, regardless of monetary reward or any of that. I think that's and we'll never stray away from that as well. So I think the volunteerism definitely has to be a part of, your practice in business as well. So
It goes back to your values too. People helping people, regardless of any kind of industry you're in. That's a big theme, whether it's your education or healthcare or social services or even faith-based organizations. How can people continue to help people? Whether you're in the financial sector, there was still that servanthood mindset and how we approach the people that we are tasked to approach. How do we help them be better? And then ultimately, what do you get out of that? As you think about you and I, we're both dads, and I know my kids are a little bit older than your kids, but like, how do then we take the things that we do each day and then teach that to our kids? They will get that lesson. This is what my dad did or my mom did, and this is the value that I got out of this, and it's still helping to uplift each other.
Yeah, we're the first teachers, right? That's
Absolutely. Remember, parenthood didn't come in a playbook.
No,
I wish
I'm
it
still
did.
waiting on mine.
Yeah. It didn't come in a playbook. It's like, I'm going to have to ad-lib this thing and all the time, just going to go fly by the seat of your pants. But then you think about how we were raised. When you think about even mental health, we know that a lot of mental health challenges start in early childhood development. And so how do we have those kind of meaningful conversations? We're talking about the first thing, you go to school and it's like, okay, let's talk about the food pyramid, or let's talk about let's go play sports, and like that's okay too. But we miss an opportunity to talk about it's okay to talk about emotions when you're younger, and actually you can live the entire human experience. You can have more value as we deal with emotions in a more positive way, and it's okay to talk about things that sometimes may be up or down, and even think about seniors. There's a lot of emotions going through the aging process and a lot of change, more medical challenges, maybe family dynamics. You, at some point, you become a caregiver for potentially your elderly parent. And so there's a lot of change, and we need to be able to have these conversations to help navigate that change.
Yes. Often with our clients, we're meeting with them bedside and they're telling us, this is the family dynamics. And yes, the goal is to, find them safe resources and a good place and whichever goals that they set for themselves as well. It's our job to help them get there, but it's also, I feel like we are doing somewhat of psychotherapy because oftentimes, like you said, to childhood, and then as we age, there's those decades that, you go and raise your own families, you move, professional careers, but then when mom and dad does need help, now all of those dynamics from the earlier in their life are back at play. And now we're all adults and we're got to find a place and we have to find a home care and we need to do it fast and we all have to get along and play in the sandbox. And it's, so we're meeting them where they're at. And yeah.
We have to. It's interesting because I see these cases quite often when we're thinking about dementia and cognitive impairment that we see. And sometimes as you're going through that with families, it can expose those those rifts that were already there decades prior, and it can make it even more challenging. And so, and then let alone if you have a group of siblings that are now trying to have maybe indecision on how to take care of mom or dad, that could be even more challenging. Yeah. So again, we have to have these conversations, but knowing that we just have to kind of, like you and I, when we're seeing families, we're saying, listen, we're going to just try to stick with you as best the entire way, while still maintaining that person's, you want them to have you want to respect their wishes, you want to make them still feel like they have, they're valued, and making sure that they still have dignity at the end of the day.
Autonomy.
There you
Yeah, I think that's all we're all looking for, especially as we age. We want to do as much independently, and the older generations love doing as much independent as they can. So, and I think it's part of the care team. I think I think that's why what we do in your practice is there's a lot of buy-in from the families as well. And I think that helps us be able to get good outcomes for the loved one that we're working on trying to help.
We talk about that a lot, and again, intentionally coordinating care and us having smaller volumes allows us to make the conversations much more meaningful. And you actually know your patients. You know when you run into somebody in a store, you're going to stop, and you actually know who they are. Yes. There was times when I had a busier practice when I was a little bit younger. Somebody would stop me in the store, and I had probably about 2,000 patients around the time that I made my transition, and I would get stopped in the store, be like, Dr. G, hey, Dr. Gomez, hey. And I'm thinking like, I'm sorry, just please bear with me, it's coming, but please remind me of your name again. But if you're on the receiving end of that, how would that make you feel? It might make you feel bad if you're becoming vulnerable to your physician, and you run into your physician maybe in another facility outside of that office, and they might say like, oh my gosh, he doesn't remember me or she doesn't remember me, and then you might feel devalued. It's a number. I'm just a number. I want more, again, meaning on things, more impact. So getting to our patients, I can say, hey, hey, Bob, hey, Susan, hey, this is great. How are the kids? And you can have those conversations. And then, I hope to think that after you had that conversation, they're thinking like, oh, wow, Dr. G knows who I am. All right, then, it's all good, and go from there. So, we're invested in you. Your goals as my patient become my goals.
That's I wish that was the philosophy of life. I wish everyone lived by that, when we talk about a service-based industry, in healthcare and what we do, I think that's the model.
My journey, I mentioned that people are along the way to help you out. There was I had to have surgery in 2011. I had surgery on my pituitary gland. And I remember at the time when I met with the neurosurgeon, who was amazing. She's still amazing. And but I remember meeting with her, and I knew I was going to have a surgery done. But she took the time to say, Mark, yes, I'm going to do surgery, but I want to know more about you. What's important to you? What are your goals? And she was asking me questions about health and life. And I said, whoa, time out. I have a surgeon who's asking me questions about me instead of like, hey, I'm just going to do this on this person and then move on to the next person. I thought it was just poignant at the time. And then after that, it changed my way, because now you can have empathy for the people that you take care of. But I sat there. She had an invested interest in me as a human. And then now when I meet people for the first time in my practice, the first questions I ask them after I introduce myself formally is I say, we're going to pause before we dive into anything here. What's important to you? What are your top goals, not just in health, but what's your why in life? And then we might spend 15, 20 minutes, maybe even longer talking about that. And then we can start talking about health stuff. But it all comes back to that North Star. What's valued? What do you value? And how can we work you back towards that across any health condition that you may have?
The why. Yeah, the why. Yeah. I think the saying is, people don't remember what you said or did, but they remember how you made them feel.
It's kind of like at our wedding. It's kind of like at our weddings. Like nobody remembers like us doing vows. They just care about the party and how you made them feel. Was the food good? Was the music great? Yep. It's almost like that. Like what we do at healthcare. They want to remember the experience, and maybe it's experience that can be a positive domino effect to other things that are important to that individual. So if we can create that experience, the thing with medicine now is patients have choice, families have choice. Even if your insurance company says, I got to stay within this network, but you still have choice within the network to an extent. If you're not satisfied with where you're at with your doc right now or where you're going, you don't have to take that and just stick with it. You have to advocate and find another physician, find somebody else who wants to hear your story. And you may have to go through several versions of a clinician before you find one that's the right fit. And that's just the reality. But people have choice. And even like in my practice, people have choice. There are more physicians, primary care physicians that are going into concierge medicine. And so yeah, there's still some competition. There's choice. And we want to make sure that we deliver an experience that matters to the people that we're proud to serve.
Yes. Yep. I think the highest service will always win at the end of the day, too. Yeah.
We're fortunate in our practice. We brag a little bit, and it's really not about
As you should.
practice. No, but we're fortunate to have a 95% annual retention rate.
Oh my gosh.
And so we have to be doing something right for somebody to say, you know what, I still want to invest in myself, and I want to renew the country. You're always going to get a little bit of attrition. That's just life. But to have people that say, yes, I want to stick around with this again and again. And I've had people in this practice that were in the practice before I even got to the practice.
Yeah.
They've been in the practice for 20 years.
Oh my gosh.
It's nuts. You know my partner, of
Yes.
course,
Yep.
Dr. Saran.
Yeah.
And so he's been around 20 years doing this. And so, yeah, people have been around for a long time and still find value in it.
Yep. Yes. I know when I'm working with the families, I feel like half the conversation is just talking about how great you two are. I'm like, I know that.
You're like, I know that, but let's get to
I know.
what you need. You know, Dr. G asked me to get involved because you need something. So
Yeah.
let's talk about what you need and let's nail this down.
Yeah.
I get you now. It's almost like that sometimes with our kids. Like you're talking about our kids. I'm like, I need you to do this, and like your kid may tell you a story. I love the story, love it, but let's like focus in and let's get this done.
Yeah.
But love the story though.
Yeah. Yeah. Children tend to do that. They're good at that. Yeah.
Absolutely, one of the best blessings ever.
Yeah.
Best blessings ever. Yes. Yeah, thanks.
All right. So the last two questions.
We made it.
I know. Congrats.
Thank you.
What is the biggest misconception families have about what you do?
Okay, so I probably say the biggest misconception for concierge medicine, because that's what I do, is that it's for the ultra wealthy. I've seen my patients over the years from all aspects of the of socioeconomic backgrounds come in, and I'm quite reminded of when I was making my transition. There were people that when I announced that I was going to transition to concierge that said, "Hey, I'm not gonna give any more money to the health system or Dr. Gomez than I'm already doing right now." You know, and then some people say, "You know what? I may be maybe traditional middle class in this country, or upper middle class in this country that says, you know what, I have to do this. I have to do this because if I go down with the health challenge, it's going to be pretty disastrous for my family. So we can't judge. You have to have people. People are going to decide what they're going to do with their money anyways. They're going to go buy something. They're going to go on vacation. But again, I tell people for the price of about a Starbucks a day, covers the cost of your membership and the medical practice. And so you're seeing that kind of a transition, a change, and this awareness. And I think that's another reason why people are driving it. Yes, they have to pay out of pocket to be in the model, but again, consumers are driving demand for concierge. So the biggest misconception is that it's for the ultra wealthy. That is not true. No, that is not true.
Thinking I need a change as well.
Hey, my door's open.
I know, that's what I was going to say. I know a doc. So if a family is listening right now and is at the very beginning of the journey of questioning, is it time to change? Overwhelmed, where do they start? This is a trick question. This is 2 in 1. What is the one thing you would tell them then?
Well, I'm blessed that I get to meet with families all the time. Families that are thinking about joining our practice or joining a model, or people that are just saying like, I don't know, I just want to learn more. The question is, I always tell people, ask the question, what matters to you most? What are, just like when we're little, if we're going to make a decision, you might write down pros and cons. And so ask yourself, what's working for you now? Is what's working for you now, is it helping you get to your goals? If not, then we might want to think about a change. If it is, then maybe, as that saying goes, if it ain't broke, don't fix it. But if we're thinking about you, and I say what we do, it doesn't matter if you're a weekend warrior, you just want to have overall health and well-being, if you have chronic disease and you have a lot of conditions you just want to be better managed. We see across the continuum of health. There are some people in my practice where I might only see once a year. They are as healthy as you can be, but they come in and say, I want to go through this stuff once a year. I want to have my executive level physical. I want to go in on all these labs and other diagnostic testing that we do, and I want to make sure I am good. But I really tell people, think about what's important to you. What do you value most? If there are any pain points in the current health experience that you're having, give us a consideration. Come reach out to us. Ask us what can we offer you in our model, and how can we help you meet your goals? Sometimes, a lot of times it works out, but sometimes it may not be a good fit. And I think we get to decide about what is good or not. People have to really make their decision, but there's a fit. And I know I'm a realist as well too. There are some things that I just can't do. I don't work miracles. And sometimes I don't. Darn it, I don't. But sometimes I may not be able to help, or I might say to a person, you know what you're getting right now, as we had this discussion, because I do meet and greets with all my prospective patients, and we sit down for about 30 to 45 minutes, and we talk about just what's important and everything, or what are your goals, and talk about our model. And sometimes I might say, you know what you're getting right now actually is really good. And I might say, I know that doc, and that doc, he or she is excellent. And you know what you're getting right now, if you're not having any pain points, maybe you stay in this model. Maybe stay in what you're at with traditional medicine. But we know that most of the time when people seek us out, they're looking for change. So I have to be pragmatic and realistic at the same time, that they're looking for a different experience. So that's what we talk about.
That's so funny you mentioned that sometimes the answer of the solution, they're looking for us for change, and oftentimes we work with a lot of families that are like, I'm not happy with what's going on here or what's going on at home, and because we do this for a living, we can usually just give them the free resources and saying, try to work it out first. Right? We don't always need to jump to the conclusions of. So I like how you said that, because I think that shows your respect for what the family wants. And you're not just looking to accept a new family.
Yeah. We want to get into an agreement that is truly values driven, and certainly values driven, not for what we do for doing our due diligence and taking an oath and trying to do right by people, but also people that really think about, I want to work on wellness. I want to have a foundation for success. I want to work on overall well-being. I want to have a preventative mindset. I want to have short-term and long-term goals that are realistic, that we can achieve. It's those kind of individuals where we see that, whether they have no medical issues or they have a lot of medical challenges, we can still work across that continuum to help them out. And again, I think about what we do is having deeper, more meaningful relationships can be incredibly important to provide the care that we strive to provide. And I do say this, Ben, I do tell people, if we're not doing something that we should, like, call us out, or if we're doing something wrong, like, it's a growth mindset as well too. I'm not a fixed product a finished product as a physician. I am still in an evolution myself. I'm in a different life stage now as I get closer to 50 than I was when I started, when I was 30. It's different. Life has changed. I have a wife. I have children. I've grown. I've had lived experiences, and so that changes how I approach patients as well too. But you can meet people where they're at too, because they've gone through similar changes. And that knowledge can be given backwards as well too, spread forth. I should say backwards, but the knowledge can be passed down as well too. I learned so much from my patients that have been around, that are in their 70s or 80s or 60s. I mean, but there are these shared human experiences. Obviously, the biggest shared human experience we had was COVID, and that was a shared human experience. But the shared human experiences in life, what it's like to be a parent, raising kids, being a professional. I think about my parents who now have grandchildren and what they've gone through, and I hear those similar stories in the patients that I get to see as well too. Or the young families, they just had their first child or second child. They have so much at them. How can I, even as a physician, help guide them through it from a health standpoint? Because if you have your health goals and you have your life goals, and if they're separate, we need to make sure those goals are together, because what you do in health, the more success you have with your health approach, can lead you to more opportunity for success in life.
Like what you said earlier was if there's gaps, that's where the things are able to go wrong, and so having those goals combined is so important.
Excellent.
Yeah. Well, as we begin to wrap it up, is there anything we did not get to? Is there anything you would like to discuss about the practice, or?
Well, just a quick plug to our practice. Our practice is excellent. Endeavor Health, Concierge Medicine. The great thing about our practice in Concierge Medicine through our health system, right now it's 10 of us physicians, and we care for over 3,500 patients that still choose us to be their docs. They are intentional, and we want to continue to provide high quality, high access, personalized care across the continuum of patients. I use that word continuum again, but we want to continue to deliver care that is right for them and meaningful for them, and ultimately having people live to be the best versions of themselves.
And are you accepting new families?
So in our practice, we are accepting new patients, new families. As I said earlier, the only thing that's constant in life is change. We are about to welcome a new partner in our practice. His name is Dr. Robert Lajawa. He's joining myself and Dr. John Saran. And my partner, Dr. John Saran, will be retiring at the end of this year after a long career of over 40 years in medicine and over 20 years in concierge. And so we have a new doc who's been around for 20 plus years, just like me, but he's starting his transition in concierge next month in August. And so he is getting the majority of new patients, partly because I have a fairly full panel, but he is going to be amazing, and I'm looking forward to spending a long time practicing with him and making more impact.
Good. How do you recommend they get in touch with the practice?
So we can find our practice just going to Endeavor Health, endeavorhealth.org. You can search under Concierge Medicine, and our profile should pop up. Now, of course, you can follow me on any of the social handles. Basically, at I was thinking of my social handles. It's funny. It's like, oh yeah, you can find, just type in Dr. Mark Gomez. You'll be able to find all my handles on the socials by looking at Dr. Mark Gomez, Dr. G.
Dr. G.